Welcome to another edition of eCW Podcast. I'm your host, Brian Saal. Today we're going to be talking about telehealth services, and with me today is Rakhee Langer from our healow area. Rakhee, welcome to the show.
Thank you.
Thank you for being here.
Thank you. It's my pleasure.
So telehealth services. Tell us a little bit about telehealth services.
Telehealth services is basically a healthcare provider who is able to offer additional services mainly to cater to the patient's needs over audio and or video, just to expand their access and make sure they're available for their patients.
What kind of providers would find it most useful for them?
In fact, providers of really all specialties can actually use televisit services, telehealth services. What we have seen in our experience is that providers who are offering any form of behavioral health services or post-op and pre-op sort of procedural services, they're all able to offer telehealth services. Typically, anyone who does not need a physical exam right off the bat, you can offer televisit services.
So I guess the flip side of that would be, how is this helpful for patients?
Very good question. In fact, one of the first things that comes to my mind is this practice in Florida, a pediatrician who has offered this for their ADHD patients, the kids.
Oh.
So anytime there is either distance or accessibility that comes into question, televisit services is a great expansion because you're able to offer the similar care and what you would offer in office over televisits, so it actually makes it easier for the patients and for the staff. They're able to go ahead and take care of the patients there.
Yeah, I've actually heard of a provider's office down in I guess it would be southeast Texas, that helps out with medical care for people that are in the central part of Texas who are working on the oil rigs.
Exactly.
And while they have a nurse that's on staff there,
Yes.
It's tough for them to be able to get a doctor to diagnose things. So the telehealth services was able to provide those oil rig workers with a much higher level of health care.
That's exactly right. In fact, on the similar lines, there is another group, again in Florida. They offer televisit services for their patients who are in nursing homes. So again, the concept was the patients were finding it hard to get to the doctor's offices. So the doctor's office set it up in a way that the patients can connect with their healthcare providers in the office over televisit services right from the nursing home. So it makes it a lot more convenient.
Sure.
But it also keeps them connected with the doctor, which is a very, very big advantage.
I'm a technophile. I love technology. But to be honest with you, it's a little daunting to me to say, all right, I'm going to hook electronically up with my doctor. I'm going to be able to see them. They'll see me. We can talk. We can chat, etc. How easy is it to use?
So it is actually very, very straightforward from the patient side and the doctor's side. So let's talk about the patient side, because you as a patient would want to connect with your doctor. It is, part of how your doctor offers it. So it makes it a lot more, it's your own doctor who you've been seeing. So you can, as a patient, connect via the healow app or through the portal, which you have access to. And, technology-wise, it's very, very simple, where with the app, you can just open the app and actually automatically connect.
So let me see if I understand you correctly. You're saying that through the healow app, which I have on my smartphone,
Yeah.
I can actually initiate or have a televisit with my provider through my smartphone.
That's exactly right.
That's the case.
That
Wow.
is exactly the case. So your smartphone, which can be either an Apple phone or the Android phone, it really doesn't matter. It has the healow app, and one of the options there is to initiate the televisit right from within the phone. So you're able to start a video call and connect with your doctor.
Be literally anywhere.
Yes, exactly.
Literally anywhere to do that.
Yes, we have heard of different scenarios where patients are either in the park or the parents are actually picking up their kids from their schools, and it works just as seamlessly.
That's fantastic. That really is amazing. Now, beyond the normal interaction between the provider and the patient, is there any other information that the televisit services can gather for the provider?
That's a very good question, because I think it cannot be a one size fits all. What I mean is, a behavioral health counseling, the counselor is looking for information specific to behavioral health, whereas a provider who is offering televisit services for, let's say, a post-op is looking for different information. How's the pain scale? What is your pain level like? Are you able to take care of the pain with just the meds out of the ones that we have given, so on and so forth. So we could look at different questionnaires in a way to actually send it to the patient. So each specialty, each provider can configure what kind of input they need from the patient, and that automatically pops up. Whether you're using the portal or the app, that's the same set of questions that you would be able to complete.
So like in the case of the portal, these questionnaires are based on visit type.
That's exactly right. That's the
So
same
the
thing
same
that's been
thing?
expanded, so that a televisit, now you can say that this provider who's a cardiologist is looking for a different set of questions from the patients to be answered. That's exactly right.
And that information can then be incorporated into the note.
That's it. Yeah, 100%. So the part of how the patient has responded, the rest of it follows the same protocols of being able to make it a part of the patient data input into the progress note, and then the provider can go ahead and complete the note from there.
Wow, that's a time saver right
It
there.
is 100%, yes.
Now, one of the other things that has kind of intrigued me about the telehealth is its use with either, say, dermatology or wound care.
Yes.
Can you talk a little bit about that?
So I think the most common ways that you look at televisit, or at least initially when you're looking at televisit and saying, this will work great to show the doctor something on my hand that's come up and things like that. So there are two aspects there. One is the provider being able to see it with high def and able to actually see what's happening.
Sure.
With the patient context as well, so you know how it is actually impacting the patient.
Right, and that's different than the patient, say, taking a picture of
and
it
then
and
sending
emailing it or
That's
something.
exactly
Yeah.
right. That's exactly right. So you're able to have a conversation, pull in the history of what happened and how and so on. So it's a conversation. And when they're actually showing it, the provider can capture the image and make it a part of the note as well. So their initial consultation can be documented in context of that specific image or the wound care. How is that actually getting better? Whether it is that it's as designed and the patient's doing well, don't need to come to the office, or if it's something that the patient now needs to come and it didn't
Right.
really, heal as initially thought, why don't you come into the office? So it can actually take different routes based on what the televisit outcome is.
So for follow-up visits, for example, the provider would be able to access that previous picture, get that in the note, take another picture and compare the two?
100%. The televisits for the provider is included in the EMR context. So it is important that the provider is able to see and access all the previous notes for the patient, also able to see what was done as part of the treatment protocol, also look at the medications prescribed, what is the patient on, and be able to actually compare the two images also right from within the progress note. So they're able to look at both the images or also change the treatment based on what was previously prescribed.
Huh, that's amazing, really is. Let me ask you this. Now, we've been talking about how patients and providers can interact. What about clinics and providers interacting? I've heard of something that we have now called a virtual waiting room.
Yes.
Can you tell us a little bit about that?
Absolutely. I think one of the major aspects of the healthcare area has been accessibility. I call that accessibility because there are patients in different geographical areas where there may be not as many specialists, not as many providers easily accessible. They may have one clinic for 100 miles and so on and so forth. So one of the areas that we've heard a lot of interest in and what we have developed is the concept of a virtual waiting room, where a patient can come into a healthcare facility but the provider may not actually be there physically at that facility. The nurse or the clinical staff can actually work with the patient, complete the initial assessment, take their meds, histories, and actually have them in a virtual waiting room where there can be a really big TV screen, which can then connect them to a specialist or a provider, any of the providers, in a different facility. Typically, driving from that facility would probably take an hour or so,
Sure, yeah.
right? So you can actually expand that the provider there was available, and you can actually just connect with the patient right from, within the other facility. So it makes accessibility much, much more convenient for
And as I think about it, it really helps out with no-shows.
Yes.
Because you're not driving that distance and
Exactly.
then having a patient not show up
That's
for
exactly
you. So
right.
that's another real added bonus
Yeah,
to it.
yeah.
So.
Some of the interesting areas we've seen doctors who want to, or clinics who want to use this, is where they have, let's say, an OB initial visit or some form of an initial visit where the patient comes in, there is either just blood draw that's done, and then there is a conversation with the provider, and then there is a follow-up visit where they're actually seeing the patient.
Right.
So they can actually have this form of, this form of televisit services to help complement what they're doing in terms of, labs and a physician's consult, so on and so forth. And Medicare also is changing a few things. They've proposed some new regulations around the televisit services for providers to be able to check in with their patients and reimbursement around that. And the technology is going to play a big role in making sure that they keep the patients healthy.
Well, finally, I guess the bottom line is the bottom line. And how much does this cost?
So the televisit services is actually just usage-based, which means that if they are able to offer this and the patient's using it, it is $2 per visit. That is as simple as that. There is no other upfront cost for that. It makes it easier for the providers to start onboarding as well.
That's just great. What a fantastic service. It really is.
It is.
Changing the face of how providers deal with patients.
Absolutely.
Really is.
Absolutely.
Thank you so much for being with us, Rakhee.
Thank you
It was
so much.
very, very interesting discussion.
Thank you for having me.
Thank you for being with us today. And if you'd like to see more eCW podcasts, you can join us at iTunes, my.eClinicalWorks.com, and YouTube. Thanks for joining us, and we'll see you soon.